A complaint about the number of hysterectomies at a Georgia immigration detention center sparked a Homeland Security investigation. Dawn Wooten, a nurse at the facility, is seeking federal whistleblower protection after raising concerns about the number of women at the Irwin County Detention Center who had the surgery. She also spoke out against sanitary conditions in light of the pandemic.
I was told not to tell officers that there were detainees that they dealt with day in and day out that were positive. We have families. We have lives.
An Associated Press review of the case did not find evidence of mass hysterectomies. A lawyer who helped Wooten told the Washington Post she felt there were enough to need the investigation. Donna Abbott is Senior Vice President of Global Refugee and Immigrant Services at Bethany Christian Services. She joins me now to talk more about this investigation. Donna, thank you so much for coming on the show. What can you tell us about this investigation and the concerns at this particular detention center?
First of all, the fact that the Homeland Security is going to do an independent investigation is much welcomed and should be transparent. It should be available to all, whatever the findings are. Incarcerated women should have the right to have an advocate present when they're considering a life-altering surgery, especially in such a confined condition. You add to that with COVID-19, these women are even more vulnerable to severe side effects after a major surgery, and they're in congregate care. I believe that Homeland Security, ICE, has available to them some programs that allow for families, women, to be released into their community. A healthcare crisis certainly would be one of those situations that should promote their release to an alternative to detention program.
Donna, how common are hysterectomies in these centers?
I'm not aware of the statistics. I'm not a physician. I can't evaluate the appropriateness of each decision, though I think it needs to be evaluated. Often what seems like informed consent in a confined situation may not be as informed as people may at first brush believe. Women often feel compelled in those situations to respond in the way that they think is expected of them to respond. Or they may not understand the totality of the decision they're making. And thus a legal advocate, an interpreter who has an understanding of medical interpretation should be present to help guide a woman through that decision. But ultimately, if the woman were in a community setting, she could turn to her faith, to her family, to help guide her through what is a very difficult decision.
Yeah, I can imagine. The concern over forced hysterectomies has really struck a nerve with the public. Why do you think this is?
Well, in the United States, we have a history of, using forced sterilizations to control minority populations, right, and control the birth rate in those populations. Whether it was with Native Americans, Puerto Rican women, African American women, and so here we have another situation where that history seems to come to the forefront when a minority group, minority women, are involved in uninformed procedures regarding their reproductive health. Again, we have to see what the findings say, what the investigation brings to light. Again, we need to insist that be very transparent so we can evaluate whether history is repeating itself.
Okay, terrific. Donna, thank you so much for coming on the broadcast. Appreciate your insights on this story. Donna Abbott with Bethany Christian Service.